Heart disease kills more women than all the cancers combined, yet 80% is preventable. Today, I sit down with Dr. Shipra Hingorany to talk about ways in which we can protect your heart. I hope you enjoy my conversation with Dr. Shipra Hingorany of UCLA. When should you start thinking about your heart health?
I don't think there's actually a certain age that you necessarily need to start thinking about your heart health. I think it's something we should all be mindful of, even from very young people to older people. You should be focused on what symptoms you may be experiencing, what your family history is, and if you're questioning it and thinking about it, it's time.
So 80% of heart disease is preventable. How?
Heart disease is preventable by taking control of your habits, by taking control of your health, and by checking in with your doctor. The preventable part of heart disease is focused on things like knowing your numbers, knowing what your blood pressure is, knowing what your cholesterol numbers are, knowing what your sugar levels are, knowing what your diet and exercise are like and what they should be, knowing what your family history is. These are some of the biggest risk factors for future heart disease. And by knowing these things and taking them to your physician and having your physician assess your risk, you can start intervening where you're going wrong so that you don't become part of that 80% that could have done something differently.
Can you give us a list of some of the important conversations and questions you should be asking your doctor when it comes to your heart health?
Sure, of course. So I think some very smart, helpful questions patients can ask are, what can I be doing? What am I not doing in regards to my lifestyle? Lifestyle is so important. And so a lot of it people think is common sense, but I really think diving into questions about, this is what I eat, this is what I do for exercise, or I'm not doing any of these things, what can I be doing better is very important. Asking how your family history affects you. Some parts of heart disease are inheritable, some are not. So laying out your family history and asking questions about what's happened to your family members can be helpful to ask the cardiologist as well. Also, just asking about any symptoms you're experiencing. It's often helpful if patients have kept a diary of symptoms to see if there's any patterns to their symptoms. So these are some of the questions that I find if patients ask, it helps to guide our encounter a little bit more efficiently.
Wonderful. And then what about, do you advise that a patient comes in with a family member or records your interaction? What do you think is most helpful for a patient interacting with you?
Absolutely. I have patients do everything from bring family members in because there's often a lot of information that's provided during visits and is not possible to retain all of it. They take notes, or sometimes patients will ask if it's okay that they record. So any of those are great ways to capture the visit and then go through it again, just so you make sure you're not missing anything. I try to provide my patients with detailed recap summaries of our visits, so they get detailed notes going over what we've discussed and what my recommendations are.
Tell me more about your connection with your patients.
So I find that it's not enough just to know the facts of their medical history, but find out who they are as a person, what their family's like. They're not only their nuclear family, but extending out to their parents and siblings, finding out what they do for a living, what their stressors are, what brings them joy. Because in order to take care of a person's heart, you have to take care of their whole body. So I think it's very important for patients to be involved in their care. And I ask questions about their home life, their social life, what they like to do, because it all relates together. A healthy heart requires a healthy mind and a healthy body. So it's very important.
For the past 12 years, I've helped to facilitate a support group at UCLA for women in heart disease. Now, one of the most common questions I get is, what am I supposed to do if my cardiologist does not listen to me? What can you tell them?
That maybe it's just not the right connection, and that's okay. People feel badly if they want to switch doctors and that they don't feel like they're heard. You should have a physician that you feel like is hearing you, because what you have to say is important. So you have the prerogative to advocate for yourself and look for that person that you feel will listen to you.
What do you think of the word heartquake or trauma of the heart? What would that mean to you as a cardiologist?
First of all, I love the term heartquake. I think it encompasses so much more than just what happens to a person's heart medically, because it goes beyond just that. It goes to their soul, to their spirit, just to their core. So it encompasses just how it affects your body and your life beyond just physically how it affects your heart.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart healthy living. And remember, wellness starts with the heart.